school-aged child passed away on November 13, 2022. This is the first reported flu death this season in King County and in Washington State. This is also the first pediatric flu death in King County since the 2019-2020 season. Since October, we have seen early and rapidly increasing flu activity locally compared to past seasons. It is a great tragedy when a child is lost to illness. Our deepest sympathies are extended to the child's family at this time. This death comes at a time of a steep rise in community respiratory viral infections, particularly among children, leading to increased emergency department visits and hospitalizations regionally as well as here in King County. The trends that we are seeing in pediatric hospitals is akin to severe surges we have witnessed during the pandemic. And it is likely that these trends will continue in the coming weeks and will likely continue to add to the burden faced by our healthcare system. This case is an important reminder to all of us that flu can cause severe disease, particularly among vulnerable individuals. And this includes young children, older adults, pregnant people, and individuals with chronic diseases. Taking precautions now is imperative to limit the spread of infection in the community and to protect ourselves and our loved ones from severe disease. Now, we are coming up on the holiday season, typically a time when people travel and see family. This also creates environments where respiratory viral infections can be transmitted from person to person. So it is imperative to take steps now to prevent illness and protect those from most vulnerable to severe disease. And let's walk through some of these steps. So some of these steps should be familiar to everyone, but it's important to reiterate. And this includes staying up to date with recommended annual flu shots and COVID-19 vaccines. At this time, there's no vaccine against RSV, which is another one of the respiratory viral infections, which is contributing to the burden that we're seeing in the community. But getting vaccinated against these other respiratory viruses will help keep you and your loved ones safer and also help protect our fragile healthcare system. Now, remember that the flu shot is recommended for all individuals 6 months and older. This is a vaccine that you get every year. So if individuals haven't gotten it this year yet, they should go ahead and get it now. COVID-19 vaccines are recommended for all individuals 6 months and older. And there's also an updated bivalent COVID-19 booster, which is available for all individuals 5 years and older. So even if individuals had a previous COVID-19 booster, the updated booster is still recommended for those who are eligible. And it's an important reminder that if you are due for both vaccines, you can safely take both vaccines at the same time. It's one of the tips that we've been encouraging people to employ as they consider family gatherings during the holiday season is really to ensure people who are attending these family gatherings have also taken the proper precautions, including staying up to date with recommended flu and COVID-19 vaccinations. Now, we know that we always have to pair our vaccinations along with health behavior strategies to help limit the transmission of viruses. And so some of these health behavior strategies include wearing a high-quality, well-fitting mask when in indoor public spaces, and a reminder that even if you are sick, you should avoid other people, including staying home from work or school. This is especially important even if you have mild symptoms or test negative for COVID-19, as severe disease may occur among those most vulnerable. So individuals may feel, they're healthy, they may feel like their symptoms are mild, but mild symptoms in one person may not lead to a mild disease in another person. So we're really trying to make sure that people don't transmit infections to people who are vulnerable. And on top of all of this, we also encourage people to take hand hygiene seriously and wash hands regularly.